So we're here with our lovely patients, just 2 months, maybe a little bit shy of that, after a revision rhinoplasty. So this was a pretty complicated rhinoplasty. And if we look, we have our befores over here. The main concern was excessive widening, but the biggest issue was the primary rhinoplasty resected too much, and when we got in there, all of this septum down here was missing. So we not only lowered this, but we had to build up the entire part of the bridge and support the tib, which if we looked at it back in the day, we could have pressed on it and it would just kind of fallen. And additionally over here, if we look at the 3/4, we see the dip as well. And one of the most important parts, and this is what I talk to everybody about, is it's not so much the size of the tip. When we refine it, it's about the shape. Shape is so important. So what we did was we structured, we have a lot of grafts in here. So this is all really nice and sturdy. And again, there's a lot of swelling still over here, especially in like the super tip area. But this is really nice and strong. This is nice and strong. And we don't have that dip anymore because now we have rebuilt the entire part here. And why don't you tell us, how do you feel, how did you feel about your nose before? What are the significant highlights of the process for you?
I think it impacted me on a visual level, understanding that over time it was drooping, the tip was collapsing. What I did not anticipate was how much that septum missing in this part of my nose was impacting my breathing. So I came into it mostly for aesthetic reasons, but I have to say I'm breathing so much better now, I'm sleeping so much better. It's just that all these airways are supported like they weren't before. So it's this great marriage of having a better aesthetic result and a better functional result. So very happy.
Nice. And how was the whole awake? I mean, it was a long process because a revision is really difficult. And so I think we were at like 4 to 5 hours.
Yeah, we were coming up 4.5, 5 hours.
So, and how did that go by nicely for you?
It did. I think my recovery was much faster for it. I was back at work 4 days later, and that would not have been possible with the general
I don't
anesthesia.
always recommend that, but
it was a
some
little
people
fast.
are able to.
Fast. I would have given myself a week if I had it to do over again. I will say that for me, I'm super sensitive, so the injections were difficult for me, just getting it all locally anesthetized.
Mm-hmm.
But once I was under, once this part was under, not me, once this part was under, it was fine and we could chat, and it really made it, the whole experience felt like I was a part of the process with Dr. Z, and not just having it done to me, but we were kind of doing it together, which is really unique. And in the past, I was very skittish around pictures for rhinoplasty, and now I look at them and I'm like, oh yeah, that happened and it wasn't horrible, and yeah, there's a little bit of blood, but it's not a big deal, and yeah, it was.
Yeah, we were just actually looking at your videos and you were all excited about looking at them.
But I was so squeamish before.
Yeah, so for the overall process, revision, really difficult case and all, recovery, would you recommend it, awake?
Oh, so much. Yes, I would like to do as many procedures as possible awake going forward. Definitely.
Perfect. Well, thank you so
Dr.
much.
Z.
My pleasure.
Thank you.